Bismillahirrahmanirrahim. Assalamu alaikum. This is me, Nazir Ahmad from Pakistan. Today, our topic of discussion is factors influencing absorption. If you are new on my channel, please subscribe to my YouTube channel and press the bell icon button so that you may not miss any upcoming video. There are five factors that affect absorption. Number one, effect of pH on drug absorption. Number two, blood flow to the absorption site. Number three, total surface area available for absorption. Number four, contact time at the absorption surface. And number five, expression of P glycoprotein. Weak bases, the protonated form does not. Therefore, the effective concentration of permeable form of each drug at its absorption site is determined by the relative concentration of the charged and uncharged forms. The ratio between the two forms is in turn determined by the pH at the site of absorption and by the strength of the weak acid or base, which is represented by the ionization constant pKa. Note: the pKa is a measure of the strength of the interaction of a compound with a proton. The lower the pKa of a drug, the more acidic it is. Conversely, the higher the pKa, the more basic is the drug. Distribution equilibrium is achieved when the permeable form of a drug achieves an equal concentration in all body water spaces. Note: highly lipid-soluble drugs rapidly cross membranes and often enter tissues at a rate determined by blood flow. Blood flow to the absorption site. Because blood flow to the intestine is much greater than the flow to the stomach, absorption from the intestine is favored over that from the stomach. Note: shock severely reduces blood flow to cutaneous tissues, thereby minimizing the absorption from subcutaneous administration. Total surface area available for absorption. With a surface rich in brush border containing microvilli, the intestine has a surface area about thousandfold that of the stomach, making absorption of the drug across the intestine more efficient. Contact time, the absorption surface. Contact time at the absorption surface. If a drug moves through the gastrointestinal tract very quickly, as can happen with severe diarrhea, it is not well absorbed. Conversely, anything that delays the transport of the drug from the stomach to the intestine delays the rate of absorption of the drug. Note: parasympathetic input increases the rate of gastric emptying, whereas sympathetic input, prompted for example by exercise or stressful emotion, as well as anticholinergics, for example dicyclomine, delays gastric emptying. Also, the presence of food in the stomach both dilutes the drug and slows gastric emptying. Therefore, a drug taken with a meal is generally absorbed more slowly. The last is expression of P-glycoprotein. P-glycoprotein is a multi-drug transmembrane transporter protein responsible for transporting various molecules, including drugs, across cell membranes. It is expressed throughout the body, and its functions include: in the liver, transporting drugs into bile for elimination; in kidneys, pumping drugs into urine for excretion; in the placenta, transporting drugs back into maternal blood, thereby reducing fetal exposure to drugs in the intestine, transporting drugs into the intestinal lumen, and reducing drug absorption into the blood. In the brain capillaries, pumping drugs back into blood, limiting drug access to the brain. Thus, in areas of high expression, P-glycoprotein reduces drug absorption. In addition to transporting many drugs out of cells, it is also associated with multi-drug resistance. Thank you for watching my YouTube channel. If you have any question, please write in the comment section below.